Hello， 我是 Emma 迪用。
我是 Rachel Fan。
Hello， 我是 Catherine 展。
在过去的2年里，疫情在很多方面影响了我们的生活。
We have seen how our friends have struggled with mental health challenges, and we want to support them and others who are struggling as well. We can imagine how hard it can be when facing these problems. Support from family and friends are important, and so is community support.
我们很荣幸参与今晚举行的这一重要筹款活动。您今晚的部分捐款将用于支持青少年日间治疗计划中的户外庭院翻新工程。这次改造将使年轻患者能够继续学习基本的生活技能，例如收获食物、烹饪、园艺以及接受治疗和护理。
请您今晚捐款来支持素里医院基金会，您的每一笔捐款都将匹配与支持素里纪念医院的儿童和青少年心理健康项目，孩子们需要您的幫助。謝謝。
多謝一班嘅同學咧對年青人嘅支持嚇，咁就好似佢哋咁講，支持正在經歷緊心理健康挑戰嘅朋友同埋屋企人咧係非常之重要嘅。咁所以咧，希望各位嘅觀眾亦都記住，我哋今晚嘅籌款目標咧就係40萬，係支持素里嘅兒童及青少年心理健康嘅。咁你嘅捐款咧亦都有培生集團 Peterson 嘅提供嘅1對1嘅等額捐贈，上限咧就係20萬元。
跟住落嚟咧，我哋就會請一位年輕人 Kenny 咧，佢用過來人嘅身份同我哋分享佢嘅故事。嗱 Kenny 都話俾我哋話俾我哋聽咧，佢對心理健康嘅挑戰之旅啦，以及咧係素里紀念醫院嘅心理健康計劃咧，點樣拯救咗佢嘅生命？
咁啊，另外咧，今晚咧喺呢個節目裏邊，我哋都多次提到有關於一個嘅戶外庭院呢個地方同埋佢嘅用途啦。咁其實呢一個戶外庭院咧係真係非常之需要翻新嘅。咁所以好快脆咧，嚟自 ADTP 呢個部門嘅 Olivia 咧就會帶我哋去參觀而家呢一個嘅地方，同埋展示咧將來翻新之後嘅圖則究竟係點嘅。我都好心急想睇下嘅。
之後咧，我哋會邀請咧係素里紀念醫院嘅老年精神科醫生 Dr. Vincent Chung 啦。咁鐘醫生咧，佢會話俾我哋聽有關心理健康嘅問題嘅跡象啦，以及有關家庭成員咧點樣去互相支持嘅提示。
嗱，其實今晚嘅節目咧都經已過咗一半㗎啦。咁所以如果你仲未打電話嚟嘅話咧，希望大家咧就可以快啲拎起你嘅電話嚟捐款咯噃。我哋基金會嘅義工朋友咧將會咧等你嘅電話。咁而且咧，我哋嘅捐款熱線將會開放到今晚嘅12點鐘嘅。咁啊，大家同時間咧都可以上網捐款都得嘅。
無論你嘅捐款係多係少，都可以集腋成裘。你嘅捐款咧係可以幫助到年輕人咧帶嚟未來嘅。
I spent 3 or so years with a speech pathologist. It was a struggle that I went through for most of my childhood. My English wasn't good, but when it came to math, I just loved it so much. It gave me a goal that I could work really hard towards. But I really did not know what made me different. That's the big thing. Name calling, insulting, spitting, hitting, going through my bags. It was a lot of hurt. My stomach would get really tight, my heart would get racing, and I just couldn't focus in class because of what they said and that they're just sitting beside me basically. It's no different than having an actual bear sitting beside you in class. The complication here was I didn't know that that was not appropriate social behavior. That's why it went on for so long. I couldn't sleep at night, and I could not walk into school without thinking of what they did. My teachers thought I was just lazy and I was just making problems that aren't there. They labeled me as a behavior problem. It was a big slap in the face. I confused, most importantly, because I really didn't know what was going on. I would have strong feelings like panic, anxiety, and that went on for 2 or so years. I was at the end of my line and I got really suicidal. I felt more relieved because it provided a lot of answers. How I felt like I was different just throughout my whole life. had group therapy, music therapy, athletic therapy, individual therapy. There's more opportunity to foster deeper, longer-lasting relationships with both the other kids there and the people who work there. And we were able to deal with some of the problems that I had for like a long time that I really had never told anyone before. And that I think that was a big step for my recovery. It was a big step for them just to go to therapy. Mental health, it's a very taboo topic. It's not widely talked about in the culture that my parents is from. So a big part of it was to reduce stigma and foster understanding and empathy and just providing a safe environment at home. I felt confident, more secure in myself, happier, a more positive outlook in life. I'm studying the sciences, a second-year student, and hoping to pursue a path into either neuroscience or medicine. I started to coach a local running team at my old high school, the same building that the bear was following me around, but this time the bear wasn't there anymore. If a youth was going through cancer, if we don't recognize it early, the youth really doesn't have a shot. It's the same with mental health. It's a health issue, and by supporting youth mental health, we're giving them another chance at life.
Hi there, my name is Olivia, and I'm the Clinical Coordinator for the Adolescent Day Treatment Program, or as we call it, ADTP. Today I'm going to show you around the Adolescent Day Treatment Program's outdoor courtyard here at the Shirley Dean Pavilion in Surrey. Having this outdoor space is crucial to caring for the youth here at ADTP. Some of the young people who come to us have been isolating in their rooms and homes for months, unable to participate in the larger world around them. Research shows that being in nature is healing, and our courtyard gives the youth in our program the opportunity to spend time outside in a peaceful, protected space and connect with nature. We use this space to run therapeutic groups, community meetings, staff meetings, and as a quiet space that youth can retreat to when they need it. Our therapeutic gardening program is another way we engage our patients in mental health treatment. It encourages kids in recovery to engage in the world around them and embrace the process of taking care of themselves by caring for something else. We try to grow a wide variety of plants and flowers here. This section is mostly perennials. This is our herb garden that we use to season the meals that we make here. These planter boxes are for growing veggies. The raised boxes make it easier for youth with impairments to work in the garden while standing up, rather than down on the ground. We don't have an irrigation system though, so we water everything by hand. Since staff are only here Monday to Friday, not all of our plants make it, especially during heat waves. Many of our youth find it incredibly meaningful to plant a seed, watch it sprout, care for it on a regular basis, and help it thrive to maturity. Most of what we grow here is edible, and kids get really invested in growing their own food, harvesting it, and cooking meals together as a community. Our current barbecue is old and rusted, and there isn't nearly enough room for us to cook for 20 youth. You might notice we have no greenhouse, no storage space, no outdoor seating. Currently, our staff grow the seedlings at home and bring them in when they're ready to plant. And when we have meetings or groups out here, we carry the chairs in and out every time. We know that mental health is related to physical health, so part of our program involves helping youth get physically active. This is the bare bones gym we've set up at the back of our courtyard. Since it's outdoors, it's exposed to the elements, which makes it more challenging for youth to participate, especially in winter. The Shirley Dean Pavilion was originally constructed as a private hospital and is now well over 40 years old. The courtyard is in a state of disrepair and needs to be cleaned, upgraded, and refurbished. With the support of Surrey Hospital's Foundation's donors, we are working together with local engineering and architecture company McElhaney to renovate this important space. Let's show you the transformation drawing from McElhaney now. It rains a lot here. Built-in awnings will make the space more usable no matter the weather. A dedicated seating area makes the space more welcoming and comfortable for the youth in our care. The new outdoor kitchen will let us prepare meals together, creating community and teaching life skills. Enclosing the gym for year-round use will support kids to increase their activity level and challenge themselves to get healthy and strong mentally, emotionally, and physically. More growing space, a greenhouse, and a compost bin will help us expand our garden program and allow patients to participate in the growing process from start to finish. Notice this labyrinth pattern on the ground. Walking the labyrinth will give youth another tool to calm themselves and practice mindfulness. This renovation will transform our courtyard into an inviting space our youth will feel comfortable in and use year-round. This is just one of the many important projects that need your support to enhance the wellness of our community's struggling youth. Your support during this event will help brighten the lives of many youth who come for treatment by providing a beautiful outdoor space for gardening and other therapeutic activities. Thank you for watching.
想了解更多有關於兒童同埋青少年心理健康方面嘅症狀啊，或者治療等等咧，咁當然咧就要聽好多嘅專業嘅意見啦。咁喺呢個時候咧，我哋就請嚟素里紀念醫院嘅老年精神科醫生鐘醫生咧，同我哋講解下呢一方面嘅。首先歡迎鐘醫生先嚇 ，Welcome Dr. Chong.
Oh, thank you. Welcome.
Welcome. So, can you please tell us a little bit about yourself? Say, like where you were trained and how long have you been with the Surrey Memorial Hospital?
Sure. Yes. So I was actually born in Malaysia. I'm educated mostly in Singapore. I graduated from University of Calgary with a medical degree, and I subsequently did my specialist training in United Kingdom before coming back to Canada. This is actually my 10th year working in Surrey Memorial Hospital, which I enjoy every day of it.
Wow. So, can you tell us some signs of youth mental health struggles that parents and or maybe guardians can look out for?
Of course. The signs are often non-specific, but can include a combination of loss of interest, loss of enjoyment, disturbances in sleep pattern, changes in appetite, anxiety, tearfulness, and mood swings. However, there are some more concerning signs such as suicidality, self-harm, paranoia, delusional preoccupations, and hallucinations, which all require emergency intervention.
So speaking about mental health, so what can family do to prevent mental illness?
Well, family, first of all, they often feel lost or helpless when their child or sibling goes through a mental health crisis.
Right.
The most important advice I can give is to be, first of all, supportive, acknowledging the emotions that they're going through, and not to be dismissive or quick to offer quick fixes, as treatment solutions often require trained expertise and time.
Yeah, that's true. So, is there any message that you would like to share with our viewers in regards to children and youth mental health?
Yes, we as a community need to start discussing more openly about mental illness, which is commonly seen as a taboo, as it is often interpreted as a sign of parental failure or character weakness, but in reality, no one is immune to the risk of developing mental health illness. The incidence of youth mental ill health is unfortunately on the rise due to modern life pressures and unavoidable social media presence, but early detection is key to quick intervention and recovery.
Right. That's very important. So thank you very much, Dr. Vincent Chong, for sharing your views and your insights with us. Thank you very much.
Thanks for having me, Mary.
咁唔該曬鐘醫生同我哋分享嘅，咁有關於一啲精神治療啊等等方面嘅問題咧，大家記住咧係需要更多嘅關心，又或者係更加去了解一啲需要嘅，或者係一啲符合嘅一啲計劃嘅。
你哋好，我好感恩能夠一路以來支持素里醫院基金會。心理健康嘅問題可以對兒童及我哋嘅社會產生重大嘅影響，喺疫情期間更是如此。我相信好多人都可能感同身受，有啲人感到好驚、孤獨、憂鬱、焦慮，甚至絕望。當我哋生活喺同一個社區裏面，能夠互相支持係非常重要嘅。你哋今晚嘅捐款將可以幫助面臨嚴重心理健康挑戰嘅兒童及青少年，並且去支持素里紀念醫院嘅心理健康項目。你嘅捐款將由一位慷慨嘅捐助者提供1對1嘅等額捐贈，意思即係話你哋捐1蚊，佢就捐1蚊。所以請大家多出一分力，可以帶俾我哋下一代嘅年輕人健康嘅人生。 多謝。